You might be wondering, why am I crying during my ketamine sessions? So if you have that question, you're watching the right video. And today I want to share with you some reasons why you might be crying and what you can do about it. I'm Dr. Ko from Reset Ketamine in Palm Springs, and today I want to share with you some of the reasons why you might be crying. You might be crying because ketamine seems to dissolve the layer between the conscious and the unconscious mind. So if there's a lot of tears or sadness that's, quote, underneath of the hood, it might just bubble up to the surface. So having those emotions of sadness, releasing the tears, may be really important. It makes me think about this quote: "What soap is to the body, tears are to the soul." So when we're crying, it's actually a form of release in a way. So we have our urinary system, we have our digestive system, and those are releasing various things, whether it's urine or waste. So similarly, our tear glands are a type of excretory system, and it might be tears from joy. It might be tears from sadness. It might be different emotions that have not been processed in the past. And so during the ketamine therapy, if that comes up, that can be pretty normal for some patients, especially if they've been holding various emotions down. And just a reminder, tears can be from sadness or it can be from joy as well. It makes me think about another patient that I had who for 20 years, they did not cry at all. And during all 6 initiation ketamine series, that patient cried for each and every session. Literally, the eye mask that we give to our patients, that one was soaked with tears each and every time. So, what can you do about this? Well, anticipate that this could occur during your ketamine session. Also, know that if it does happen and you're crying, that can be within the normal range of a human experience. I've been thinking about sadness, and sometimes we cry because we're sad, we're mourning, we have emotions, or our emotional body is in pain. Well, one of the beautiful things that I've noticed is that people who can experience the most negative emotions, well, that to me means that they have the capacity to also have the most positive experiences. So as a metaphor, if you think about a piano, let's say, within the normal range of a piano, there's really high notes and then there's really deep, dark, somber notes, right? And for a human experience, it's actually having a full, wide range of human experiences rather than just a narrow subset. So know that the tears may be normal and that it may just be things that have been held down, and anticipated that it could occur, and don't be too alarmed. Now, what's going to be really important at the end is to process it. And that might look like talking with your therapist, talking with your ketamine practitioner, talking with a psychedelic integration coach. All of these things can help. And if you don't have access to that, it may simply look like journaling, creating art, but some form of integration to help process those tears that have come up.